We have a state-based marketplace here in Rhode Island. It's called Health Source Rhode Island, and this was created by an executive order by Governor Lincoln Chafee in 2011. The state's marketplace is essentially soup to nuts. We sign folks up. We have our own website. We regulate the insurance market, which means that we look at essentially the qualifications of various insurance companies to offer coverage. We regulate the kinds of coverage they offer, and we do a lot of outreach and assistance. Rhode Island's doing pretty well. In our report card, where we benchmark Rhode Island's performance against the rest of the country, Rhode Island ends up with a B-, which is slightly above average. The state has done a very good job in terms of trying to keep the cost of insurance down. We found that premiums were lower here and were falling, and that we actually had an increase in the number of insurers offering plans on the marketplace. That's good news. Where Rhode Island has lagged a bit is in terms of its ability to really sign up new customers. One of the long-term challenges here, the business case for these marketplaces, if you will, is you've got to essentially sell your product to the public. I don't think there's a clear-cut answer to that. It's going to depend on the state's circumstances. Part of our research really looked at kind of the value added or the return on investment that states were getting. Rhode Island has spent over $140 million to set up our marketplace, and we've signed up about 34,000 people, which is a very respectable number. But when you compare us to states like Maine, which has a federally facilitated marketplace and has spent less than $8 million total, or New Hampshire, which has spent about a quarter of what Rhode Island did. There's a state partnership marketplace. Both of those states signed up a lot more folks than we did, and they did so at far lower cost per person. Rhode Island could look at something like New Hampshire's state partnership marketplace. We currently in Rhode Island have a state-based marketplace where we run the website, do all of our outreach and education, regulate the insurance market. We have control over the system. New Hampshire has allowed the federal government to set up their own website and to maintain it and update it, which is a significant expense, and it allows the state, therefore, to save a lot of money on that front. Rhode Island could also go the route of a federally facilitated marketplace in which the state would essentially hand over the responsibility of the federal government. There is a cost for that because the federal government will assess essentially a per-user fee to pay for this. So it's not a free lunch. We have to sign up more people, and particularly young, healthy people. Right now, the insurers are complaining that they're losing money. And the reason that they're losing money is that most of the folks who've signed up to date have been older and sicker. And that's understandable. Those are the folks who would naturally want insurance coverage. The problem, though, is that because we have this individual mandate, which says everyone has to have insurance coverage, we need young, healthy people in the pool to offset the cost of the older and sicker folks. And Rhode Island is not unique in this, but because we're smaller, and because we don't have as many customers, it hits us harder. So as we look forward, we've got to find a way to successfully market ourselves to those folks who have yet to jump into the insurance pool.